The dual mission of the Black Nurses Coalition is to decrease healthcare disparities among African Americans and other minorities, as well as to promote African American and other minority nurses in the fields of healthcare and academia. With coronavirus now infecting tens of thousands of people in China and 12 confirmed cases in the U.S., we thought we could speak with registered nurse Brenda Robinson from the Black Nurses Coalition in Albany. It is wonderful to see you. How are you doing?
I'm doing very well, thank you.
So, it is well established that there are disparities, health disparities, especially for women, Black women. There was a study in Orange County recently in New York that found that premature births were almost double among the Black community than the white community. What is going on? Why is that?
I think when it comes to healthcare disparities, you have a lot of different elements that impact that, and oftentimes we speak about the social determinants of health.
Yeah.
When you look at the African American community, we have a lot of elements that we have to deal with, such as trust with the healthcare community, as well as past history of unequal treatment. So when we enter the healthcare setting, we have a lot of different issues that we are bogged down with when we seek care. So we can look at things such as lack of cultural competence. It's just so many different elements.
Could you give us an example of cultural incompetence?
Yes, and cultural sensitivity. I would say if, for example, if you have a doctor's appointment and you're there, your provider is there, whether it's a nurse practitioner or PA or whatever, and the particular individual is sitting there and really does not understand what the particular physician is speaking about, and that provider speaks above the level of the patient that they have, and they're not taking into consideration that one shoe does not fit all in all communities.
Right. So it's basically what we learn in communication school.
Exactly.
You have to appreciate who your audience is.
Exactly.
And communicate
Exactly.
appropriately.
Exactly.
Right. SUNY Buffalo is actually this is a huge issue. So SUNY
Well,
Buffalo
certainly
is launching a major initiative addressing health disparities among people living on the east side of the city. What do you think researchers are going to find?
I think researchers are going to find what is, I think, ongoing, not really listening to our particular population. We still have folks in leadership positions who are making decisions for people who look like me without including me. So until folks take a step back and really include minorities in the large decision-making process, we're still going to have these healthcare disparities. And inequity still exists. We have to have a seat at the table, the larger table.
The larger table, absolutely.
Yes.
You know, it's a shame is, a couple of weeks ago we talked about this diversity in medicine program. It has been zero funded in the budget this year. It's something to get people of color into the medical field. That's a shame.
Certainly agree.
Yeah. So I'm, the coronavirus is a huge deal. So if African Americans, other people of color are not going to the doctor because they feel like they're not listened to, that it's just not worth their time, that should be a public health issue.
I certainly agree.
So
I certainly agree.
What would you like to leave our viewers with?
I think engagement is very important. Engagement in the minority community. We have to continue to engage, and you have to explain issues to our community in a language in which we understand.
So your message to the African American community then, considering this is flu season?
Considering this is flu season, I think to pay attention, precautions, prevention, and
get a flu shot.
Not ignore signs and symptoms of the flu, and of course vaccinations. Yes.
Yeah, that's terrific. And where can people find out more about your organization?
www.blacknursescoalition.org. We have our website, Facebook page, Twitter. Please check us out.
Terrific. We've been speaking with Brenda Robinson. She's a registered nurse and a member of the Black Nurses Coalition in Albany. You've been terrific. Thank you. Coming up, after 40 years in public service, a Rochester area assemblyman is